over 800 healthcare professionals or healthcare providers test positive to COVID-19 in Nigeria. The major reason is this. Honestly, the fact that when this emergency came, we had to resort to makeshift provisions for purposes of isolation, for purposes of treatment. You can recall and connect correctly that even stadia were converted to isolation and treatment center. Now, you find out that when you want to talk about safety or protection of the health worker, one thing that is fundamental in quality management system is facility and safety. Now, facility and safety have two components, the primary component and the secondary component. It is the primary component that deals with issues of personal protective equipment. The secondary component deals, or what we call the secondary barrier, deals with issues of design, ergonomics. If you turn a stadia to an isolation center, you would have, of course, you will have no ergonomics, no design, no considerations for secondary barrier in place. Now, that's one of the problems. Another one is that before now, honestly, the average health worker is ill-trained on the use of personal protective equipment. And so there's a gap, training gap had existed before now. People were used to seeing patients unguarded, and that is not a standard practice. That is not best practice. That is a non-conformity. It is that non-conformity that is extending to what is happening now. Now, if you disaggregate the number, just yesterday, we buried a medical laboratory scientist who died of COVID in Kaduna State. Today again, a medical laboratory scientist died on road traffic accident en route Abuja with specimen he was ferrying into Abuja, COVID specimen. So a lot of healthcare professionals are going down as a result of exposure and ill treatment. So what we need to do is a continuous training and retraining of healthcare professionals on the donning, doffing, and the deacons in the use of personal protective equipment. Again, we must develop protocol or templates for action or activity-based personal protective equipment and train healthcare providers on that. That is not being done. It's a major challenge. What we require to go pick up a patient with an ambulance is not what we require to do a triage at the entry of the hospital. You find out that most of our hospitals are still operating as they used to. Because of this pandemic, we're supposed to have instituted a triage point almost at the gate of our health facilities. And the persons that will man these triage points at the entrance of the hospitals would have been properly kitted with the appropriate PPE to deal with that. So that's not